Over the last year and a half, we have been working diligently, tirelessly, daily to address the opioid epidemic that has ravaged Pennsylvania. So today I'm really proud to announce that the DEA, the Drug Enforcement Administration, has announced that as of their last count, almost 2/3 of the counties in Pennsylvania have seen a drop in opioid overdoses, and overall Pennsylvania has seen an 18% drop in deaths from 2017 to 2018, which is really something to be proud of. I'm really proud of the work that we're doing, that all of you are doing to make that happen. This is a great piece of news in this ongoing fight, and it reflects well on the hard work of the Opioid Command Center, which meets weekly, as well as everyone else at the state agencies, in the county agencies, at the local level, and the nonprofit organizations, all of whom have partnered together in a very collaborative way to try to address this epidemic. But I just want to make clear that while this is a great time to appreciate the progress that we've made, this is the first year that Pennsylvania has seen a drop in the overdose rate in I don't know how long. While we're really proud of that, we know that the work has we have a long way to go. We are not done as long as there is one death from this preventable illness. So we're continuing to monitor the use of all types of overdoses, not just opioids, to track our trends in Pennsylvania. While opioids have been the focal point of the command center, we want to be proactive, and we want to make sure that we're alive and aware of all the other issues that are out there. We're also continuing to roll out new programs to add to our current tactics targeting substance use disorder. So today I'm announcing a new helpline for families I have three things I want to announce. First, I want to announce a new helpline for families in kinship care situations called Kin Connector. The grandparents raising their grandchildren and other forms of kinship care families affected by the opioid epidemic or any other situation that requires care can call the Kin Connector online to get resources, find support, all of which are aimed at assisting them to find ways to handle their own individual unique challenge. Second, I'm happy to announce that we're going to be doing a second round of the opioid overdose reversing drug Naloxone handout. That'll be on September 18th and September 25th. Last year we had a great response to our first handout, saw us giving life-saving Naloxone kits, put them in the hands of more than 5,000 Pennsylvanians, and that doesn't include all the ones who got them on their own through pharmacies. And Dr. Levine is going to talk more about that when she gets, but this is a really big deal, and it started when she was Physician General and gave every Pennsylvanian a standing order prescription for the drug Naloxone. Finally, I'm pleased to announce that we've made the first grants in a new program that rewards healthcare providers who join our opioid fight in high-need areas, with education loan repayments. We've had 92 recipients of a combined $4.8 million that comes from the feds through the SAMHSA grant. And that's money that we've used. $4.8 million of that $50 million grant. $4.8 million has gone to encourage and give an inducement to people who have gone into underserved areas. And we have one of the doctors here today who's going to be talking about a recipient of that, as to how important that is to get her to where she is. So these are good things that are happening, and they're part of the continuing effort that we have. So while today is a great day to celebrate as far as how far we've come, it's also a great day to recommit ourselves to doing more to address this epidemic that is destroying and devastating so many lives and so many families around Pennsylvania. So I'm optimistic that we're on the right track, that we can continue to do good things. The American Medical Association has actually cited Pennsylvania as a place where great things are happening. And this is a few years after I think we were in a position where we were doing virtually nothing about the opioid epidemic. So we've made some real progress. And I'm very proud of what everybody up here, everybody in Pennsylvania is doing.